today is that we can kind of do three things. We can talk openly about mental health. We can give you some high-level information about what it means to struggle with your mental health. The second one being giving you some language to use to talk to someone who you might see is struggling. And the third one to give you some resources on what's available in this community here. So when we look at the reality and some statistics, we kind of get a sense for who and how many people are affected. And these statistics are all Canadian. So 1 in 5 people in Canada will experience a mental health problem every year. 1 in 3 people will experience that in their lifetime. And that does not necessarily mean a diagnosis. So it doesn't necessarily mean you've been diagnosed with anxiety or bipolar disorder or schizophrenia, anything like that. This may simply be some type of a problem with your mental health. So maybe a small bout where you've experienced some anxiety, but maybe not necessarily got diagnosed with it. It's reported that 500,000 people miss work every week due to mental health. And so what's important. That's a large number as it stands, but it's also important to consider that that number doesn't include those that are underreported. So there may be times where someone calls in sick to work, just simply calling in sick. They may not be specifically identifying that it's for mental health reasons. So that number is very likely, quite a lot higher than what we actually know is reported. 30% of all disability claims are related to mental health and 70% of the total costs. So does anyone have any ideas of why it might be so costly? Like if 30% of disability claims are related to mental health, but 70% of the total cost? Oh, sorry. And Michael, just to answer, they are Canadian stats. So any ideas from anyone of why it might be so costly, disability claims? Longer. Yeah. Longer period of time missed from work, length of claim. Yeah, for sure. Often, and it's kind of both of those things. So often why it's so costly is because mental health or mental illness related claims generally get left for so long before seeking help. So rather than, if you break your arm, you break your arm, you would probably be going to a hospital or somewhere that day to seek help. Or seeing your doctor. Whereas oftentimes with mental health, that's something that gets pushed off to the point then that someone, is so ill or doing, so poorly that they do require ending up in the ER or a lengthy hospital stay or something like that would be more costly. In Canada, the cost is $51 billion annually. And in Ontario, it's $30 billion annually. So it's important to treat it early so it doesn't kind of compound, is essentially the message there. Only 36% of people struggling say that they would discuss it with someone. And in fact, most people won't formally talk to anybody about what they're going through. So that's about 2 out of every 3 people that kind of admit or acknowledge that they are not seeking any help. And this is why it's so important for us to kind of start the conversation with other people. If you're a leader with your team members, a parent with your children, a friend with another friend, a spouse with a spouse, anything like that when you see them struggling. And we'll talk a little bit more later about just kind of some simple approaches that work if you do want to talk to someone who might be struggling. So what exactly is mental health? If I'm saying that we all have it, what is mental health? A definition that we use says that mental health is a state of well-being in which an individual can realize their abilities, cope with the normal, quote unquote, normal stresses of life, and work productively and fruitfully. So noticing that it's more than just the absence of mental illness. And what I mean by that is that you can have anxiety, but if it's well maintained, you can be mentally healthy. So similar to diabetes. You can have diabetes, but if you're managing your diabetes, you can still kind of live a day-to-day life that's very healthy. Mental health and mental illness is no different. Mental health is the capacity to feel, think, or act in ways that enhance our ability to enjoy life. So I'm not necessarily a big fan of the phrase work-life balance, because it kind of, to me, that suggests a bit of a trade-off. Good health at work and good health at home provides a little bit more of a whole life perspective. So you don't need to sacrifice one for the other. It's important to have good health at work and good health in your home. So we're going to look a little bit here at what's called the mental health works spectrum. And mental health works that's a course that we do offer at CMHA, and kind of the material that you're getting today is a condensed version of that. So the spectrum here kind of helps to describe the experience of mental health. And you can picture this as like a teeter-totter or a scale or anything like that. Something that kind of can wobble in either way and find balance in the middle. So it's based on a scale from 1 to 5. And the scale is with 5 being the best situation or experience for an individual. This is specific to in the workplace, and 1 being their worst. So you see kind of 1 on this scale being described as like a crisis, versus 5 is the balance. So feeling in control, confident, secure, resilient, involved, whatever balance and doing well means to you. We can generally apply this to any of the domains that impact our mental health. So somewhere near the middle, like I said, this balance zone where we feel in control. What 5 means on your scale specifically, might be different than what a 5 means on the scale for the person, I want to say sitting next to you, but the person, somebody else that you know, because we're not all sitting next to each other. So what a 5 on my scale might look like might be very different from a 5 on any of your scales. That's because your personal kind of perceptions of wellness and how we're affected by and cope with stressors is all something that's highly individual. So if we think of depression, we can kind of visualize what's happening in depression as a kind of deactivation. Some other words for this are maybe down, depressed, less active, insecure, disengaged, or disconnected. And it's normal for us to be pushed out of balance in the area to a degree from time to time. So it would be normal for you to be pushed out of kind of your balance zone in a time where you're maybe grieving a death, or maybe a time where children are moving out of your house. COVID is another great example. There's been a lot of change related to COVID, and I think we've probably all lost a little bit of our balance during that. If you sit in this off-balance stage, though, for too long, and this kind of maybe becomes your new normal, it's now making it more difficult to return to balance, or even to remember what that balance looked like for you. So how quickly and completely we restore our balance depends on what we would call protective factors. So those would be strategies for dealing with stress. Having a support system of maybe family or friends around you, and having hope that things will and can return to, your quote unquote normal and what balance looks like for you. When we look at anxiety, stress is kind of an activation of our system. So it engages our fight or flight response, and we often think of our adrenaline increasing. So other words that you might describe or notice, yourself saying or other people saying might be that they're feeling hyper aroused or overstimulated, distracted, irritable. Again, normal life events can push us out of that balance towards anxiety. So, for example, coping with how COVID has impacted our lives. Imagine that something was preventing you from kind of, quote unquote, coming down from that feeling. So a barrier arises that keeps you feeling like you're just stuck on a treadmill. Anxiety is like essentially this persistent mental stress. You can't get off that treadmill. It can take many different forms, anxiety can. So that might look like panic or panic attacks, social anxiety, phobias, obsessive compulsive disorder. And again, how quickly you restore your balance and get back to the middle of this teeter-totter depends on all of those protective factors that you may or may not have. So because we spend about 60% of our day at work, you likely get to know what your coworker's balance starts to look like. You don't really need to know how or why someone's spectrum is that way or how it got that way, but generally you start to notice kind of what the normal and what balance looks like for your coworkers. If we start to pay attention to when someone is off their balance, we can kind of start to recognize if they might need help. And we'll talk about a simple 3-step approach to having that conversation as we move forward in this webinar. Okay, so what is stress? So if we focus a bit more on kind of the activation side of the spectrum, I want to talk a little bit about specifically about stress and anxiety, because I think that those are probably two things. Oh, I'm going way ahead. Sorry about that. Okay, so focusing a bit more on stress and anxiety. Sorry, I wasn't sure if someone had just put something in the chat there. So stress is the body's response to a real or perceived threat, COVID being a really good example of this. So that response is meant to get people ready for some type of action, to get you ready in danger. It's not necessarily always a bad thing. But most of the threats that people face today aren't necessarily something that they can fight or run away from. As much as it would be nice to probably run away from COVID. These threats are usually problems that people have to work through. So stress is a reaction to a situation. It isn't about the actual situation necessarily. We usually feel stressed when we think that the demands of the situation are greater than our resources to deal with whatever that situation is. So in this time of COVID, many of us are feeling like the demands of coping with COVID and keeping ourselves safe are greater than our resources to deal with it. We start to feel fatigued from the constant worry or stress that we feel. And stress doesn't always look stressful, or you might not even feel like it always feels stressful. You might not be associating it necessarily with the physical signs to the fact that you are stressed. Can anyone think of what some of those physical signs might be? So feel free again to either throw that in the chat or just unmute and toss out what some of the physical signs of stress might look like.
I have a couple.
Yeah.
So sometimes the physical signs could be tension in the neck.
Yep, absolutely.
Sometimes tension in the upper back. I know like a lot of us sit at desks for long periods of time. So I don't know how much of that is like stress from work or, you know, the positions that we're in. But I mean, it's ultimately stress on the body.
Absolutely. Yeah. So any type of tension, that's a great example. Absolutely. Sometimes that tension for some people turns into a little bit of a headache or noticing that you're having headaches more often.
Yeah, exactly.
Sure, that neck and upper body.
Yeah, I actually noticed, at first I thought it was headaches, but then I realized it was just referred pain into the head from the neck and the shoulders.
Yep. Yeah, and I'm sure you're right, because you had said a lot of people either working from home or working from desks, and I think it can probably be a bit of both, the difference between your actual, like your physical work environment and kind of the ergonomics related to that, as well as just the stress of, life and everything else related to that. So some other suggestions in here, again, tension in the neck, absolutely. Nausea, feeling unwell, feeling distracted or like you can't concentrate. Those are all bang on, awesome examples of some of the physical symptoms that you would maybe experience related to stress. Like irritability or sweating, not sleeping well, all other examples as well. So if we look a little bit at kind of stress during COVID-19 specifically, that can kind of not change things, but it's just a good example and something I want to address today, because COVID has kind of become our new reality. I think we've learned over time it's not something that's going away anytime soon. And so how do we cope with that, and what does that look like? So due to COVID, we're currently experiencing obviously a number of different types of grief. And they can be kind of small losses that continue to happen, vacations we can't have, celebrations that you can't host, people that you can't always see. We feel like the world's changing, and it has. Even though we know this is temporary, it doesn't always feel like it right now, because there is so much uncertainty about when it will end, or what our new normal will look like and when that will be. We're experiencing grief in forms of our collective loss of normalcy, fear of the economic toll, loss of social connection. And I think a lot of us feel as though we've lost our sense of safety and security, especially since this is something that we can't see. Our minds are being fairly protective, I think, during COVID. So generally what this means is that we look at worst case scenarios and we try to protect ourselves. So we focus on the rising counts in cases, repeatedly checking the news for reports on maybe the pandemic. We think this is only going to get worse, or so many people have been affected, it's only inevitable that we're going to get it too. Or maybe even those thoughts of this will never end. And so just important things to consider of how maybe you're experiencing stress due to the pandemic in ways that you haven't always realized. And there's just a link at the bottom of this here, and I can always send out the slides after as well, but to an article, a Harvard article about the discomfort that you're feeling during COVID, and how a lot of us don't know how to name that. And essentially what it is that you're feeling is grief, this huge sense of loss. But I think we don't always name it as grief, because that's not typically what we think of when we think of grieving. So it's important to do what feels good for you. So responding to stress at this time, I mean, especially in your workplace, feeling like you're being put under maybe more pressure would be a little bit normal, or whether you're being put under pressure or not. I know a lot of messages that I've heard from people working at home is that they find they put themselves under a lot more pressure to kind of keep up and prove themselves, because they're not in that office environment every day. Feeling stress is not a reflection of what you can or can't do in your work or in your home. So managing your mental health and well-being, especially during this time, is really important. And it's just as important as managing your physical health. The physical things you're doing to protect yourself from the virus, so wearing a mask, extra hand hygiene, all of those things are equally as important to the things that you're doing to protect your mental health. Sometimes it's really hard to identify what those coping strategies are, or what you do kind of to feel mentally well. So I would ask you kind of to ask yourself the question of, what do you do when you're feeling your best, and what does that look like? So when you're doing your best, are you someone that's going out for bike rides, spending time outdoors, appreciating nature? Maybe when you're feeling at your best, it's because you're taking care of yourself by doing things like ensuring you get enough rest, eating healthy foods, engaging in physical activity, staying in contact with family and friends. And it's important to acknowledge that those coping strategies that we use in normal times might not always work during COVID times, or we might need to kind of experiment with different ideas or different ways that we can still accomplish those things. So if you can't see someone, in person, do you, meet over Zoom, or can you meet somewhere outside, have a phone call? I know for myself, something that was a big change, I went to the gym fairly regularly before COVID hit, and that was something for me that was a big stress reliever and mood booster. And for a period of time there, I really didn't know how to replace that. I think it probably didn't help that COVID really hit in March when the weather wasn't the greatest outside either. So finding a way, it took me a bit of time to kind of discover a bit of a new routine at home that I could do that was equal to kind of what my gym routine was. And another, important point on that, because it does take time, is to be patient with yourself. It's going to take some trial and error, especially during a time of a pandemic, to figure out what's going to work for you. When you look at responding to stress at work, this might look like you're kind of rotating your tasks from higher stress to lower stress functions if possible, performing tasks that require high energy at your peak times, saving administration tasks for maybe lower energy period times, setting reasonable goals for yourself every day. Instead of focusing on, all your to-dos for a particular day, focus at the end of the day as well on what you got done, right? Remembering that there are accomplishments and you are accomplishing things right now. Some other things that you can do that can make an impact on your stress level are limiting your news consumption, seeking only reliable information. So this is something that I've heard from a lot of different sources and a lot of different people, right? Is there can be so many different news sources out there, and so many things that are maybe shared on Facebook or social media sites that we don't actually really know where they come from. So making sure that, what you're taking in is, one, something that you're in a place to take in, and two, something that is accurate. So for me, I found that I do what I need to do to protect myself, to wear a mask, to stay within my bubble, all of those things. For me, it's not helpful to see what the daily numbers are. That makes me feel a lot more anxious. For other people, it's quite the opposite. Knowing what those daily numbers are helps them to know kind of where things are at. So figuring out what that means for you. Keeping things in perspective is important. So focusing on the things that you can do to feel in control, and not just focusing on all the things that you don't have control over. Taking the recommended precautions by Health Canada and your local public health unit, and taking things at your own pace as you're comfortable with it as well. So just because, maybe Health Canada or your local health unit says that it's okay to be in, groups of whatever size, if that's not something that you're comfortable with, it doesn't mean that you have to be. And knowing that there is still help available. So reaching out for that help if you are struggling. And again, as we kind of shift through this presentation, I'll get a little bit more into resources that are available in the area as well. So up until now, as we move into the next slide, we've kind of been talking about our own individual mental health and stress responses. We're going to shift gears a little bit, for lack of better words, as I've got some gears up here, to talk about how you would talk to someone who you see is struggling with their mental health. So this could be a coworker, someone you employ. We'll focus more on mental health in the workplace for the purpose of this presentation, but these are all things that are transferable into your everyday life outside of work as well. So we have a little bit of an outline here from the Mental Health Works model, and each of these steps is kind of what they consider a gear in the conversation. So recognizing with this that I realize that you're probably not all counselors, and this is a pretty high level approach. So we're not going to get into deep conversations with people, but we're going to use this as a guideline just to open a discussion. I want you to feel more comfortable with having these kinds of conversations because, like we said, mental health is health. It's there for all of us. If someone came into work with a broken arm, you would probably notice something was wrong and say something right away. And I want you to know how you can do that when it comes to mental health as well. So first here we have intentional noticing. Oh, and I'm skipping too far ahead. So we have intentional noticing. So what are you seeing? How do you notice? What do you notice with the person? Paying attention to stress on purpose. So starting like a day-to-day baseline. How long has this been going on? Noticing a significant change in someone's behavior, performance. Are they, someone who's usually quite timely and they're falling behind on deadlines? Are they someone who's usually quite engaged and they're not contributing to the team when they previously would have? Considering the context, is there anything that you already know of as to the reason why someone might be feeling more anxious? So are you aware that this person is maybe in the middle of selling their home? Maybe their child has just moved off to university and they're empty nesters or anything like that. During this process, it's important to be speaking in a calm voice and starting the conversation about anxiety. So I've noticed, or I'm wondering if, I'm concerned about this change I see in you and I want to learn more so we can get the right help. Those types of things. So, depending what it is you might say to someone, I've noticed you seem down today. You're usually quite chipper, and say good morning to someone and kind of seeing what the response is that you might get back, leaving the conversation open for them to kind of continue or see if they kind of take the bait a little bit. And then we move into the next gear, which is active listening. So active listening is where you're talking to someone about the anxiety. So allowing the person to voice their fear, exhibiting while you're wanting to kind of exhibit calm body language. If someone's really quite activated, you're wanting to make sure that you're not doing anything to escalate them further. So focusing maybe in those cases more on a grounding or a breathing technique rather than diving too much into what's going on. And then allowing the person to go at their own pace, right? Listening to them rather than skipping gears to kind of fix it mode. And sometimes it can be really hard to do that. So still acknowledging and allowing the person to be heard. Oftentimes, people just need to be heard and they need to talk out loud with someone. And oftentimes when we let people do that, they end up coming to their own conclusions and maybe just needed to hear their voice and get that out themselves. There's so many times where we probably do have great suggestions for people on how to maybe help with a problem, solve a problem. But we need to make sure not to just skip right to what our suggestion is and to make sure we're kind of hearing people and giving them an option to figure that out for themselves and voice that for themselves, because that can also be really, really empowering and might make someone more encouraged to talk to you again if you're able to help them through in that way. So the next gear is working together. So this is more of like a planning and acting stage. So now that you have a better idea of what's happening with someone, or hopefully kind of a good enough idea, you can start to kind of guide the conversation towards what can be done about it. So starting small, how can I help? Identifying essential tasks, chunking work, progress monitoring and support, reassuring and validating small successes. So part of this planning and action can be talking about resources that are available to them to further support their mental health, suggesting they connect with a doctor or a counselor, an EAP program, local resources like CMHA, maybe a local crisis line, anything like that. So when we look at anxiety and depression and what a crisis for anxiety and depression might look like, anxiety, can be quite common, especially right now. And you might observe increased anxiety in some of your staff, your coworkers, or maybe even in some of your clients or customers. In general, you might see that people are just having a difficult time kind of catching their breath, breathing quickly, pacing. Your primary role is kind of in those situations to mirror calmness, to breathe slowly. You might want to bring someone, if you can, to a quiet area, be a little more reassuring, or keep calm yourself. Now, some of these physical things are harder to do when you're not necessarily at work. Oh, sorry, I just see a question. I apologize. So what does grounded mean? Oh my goodness, and now I'm skipping ahead again. So when I refer earlier to being grounded, grounded is being able to bring yourself or someone else back into the current moment. So kind of while we're speaking about breathing, some of those ways to do that would be slowing your breath down, taking deep breaths, trying not to think too far into the future or too far behind you, and only focusing on the present moment. Does that make sense, Stephen?
Yes, it does.
Okay, perfect.
Thank you.
Yeah, no problem. Sorry, I didn't see that there. So when we look at kind of anxiety, mirroring calmness and breathing slowly, bringing someone into a quiet area, being reassuring, and keeping calm yourself, those are all ways for yourself to keep grounded and ways to help someone else become grounded. Usually anxiety is quite forward focused, so we're usually about 17 steps ahead when we don't necessarily need to be, or we're 17 steps ahead predicting, what's going to happen in 5 hours from now, when we really have no control over that. So depression, on the flip side, is often a little more focused in the past tense. That's something that might be also quite common right now. And when someone's experiencing depression, they might be crying, experiencing a difficulty managing their emotions, maybe expressing some statements of hopelessness. And you would want to use active listening to ensure that the person has supports in place. So if they can't stay at work, do they have someone who can check in with them once they get home? Is it appropriate for you to check in with them once they're home? For those kind of who are working from home, and I see that question there, Eric, you can still kind of use these skills. No, you're not there with the person, but do you offer, hey, can I give you a call sometime today to check in? Is there a place where you can meet virtually on Zoom, something like that, to just have a conversation with someone and say, hey, I just wanted to check in and see how you're doing. I know, it's a hard time right now with everything going on, and have some of this conversation to see how they're doing. But again, using those same skills of you yourself staying calm and mirroring that, you breathing slowly, all of those things. Does that, Eric, kind of answer your question a little bit? Yes, perfect. Okay. And people are often kind of embarrassed about this stuff. So it is nice if you can, especially, working from home, if you can kind of offer those more private conversations, not necessarily. We have a big, every Wednesday here at CMHA, we have a big staying connected meeting. And if I noticed someone was not maybe sounding like themselves, or maybe had teared up during a meeting or something like that, it would probably be more appropriate for me to kind of reach out with an email or a text message or a phone call after the meeting, rather than kind of during the meeting in front of everyone else, where it might not feel quite so comfortable. So we want to really normalize this language as well, and remind people this is okay, this happens. Maybe it would be helpful to talk to someone, or if this is something that you've experienced before, maybe sharing, if you're comfortable, sharing a little bit about that and saying, I actually had a time where I was feeling quite anxious or quite depressed, and this is what I was able to do to kind of get where I am now. Just normalizing that so people aren't feeling so embarrassed. If you're afraid for somebody leaving, whether it's, because that they live alone, or they've made a statement about something that concerns you, I would suggest kind of calling maybe your local, like calling CMHA here, or a local mental health agency if you're not here in Oxford County, and getting them connected to someone there who can kind of delve a little deeper into what's going on. Now, with that being said, if someone's made a comment that's quite directly related to their safety and they're not willing to talk to you, and you don't think there's any chance that you would be able to get them connected to CMHA safely, the option is always to call 911 as well and request that the police complete a well-being check with the person. So most people don't reach out for help because they feel so alone. And your reaction to the situation is important and can really make a difference for them. We would encourage you to kind of consider additional training specifically on how to manage these kinds of issues safely and effectively if it's something that you don't feel comfortable with or something you would like some more information on. There's a lot of different resources here at CMHA that would be able to support with that, and we'll talk a little bit about that at the end of the presentation. There's also a program called Mental Health First Aid, and it is available here through CMHA. That is something that would dive a little deeper specifically into kind of how to deal with mental health. So if we move now into kind of what some of the supports are that are available here that either you would be able to access yourself or you would be able to direct someone to or provide resources to for someone that might be considering reaching out. The first one I'm going to start with it's called Supporting Our Frontline and Healthcare Heroes. And this is actually something that's available to the public and that CMHA is offering during COVID-19. So this program was funded with some support from the United Way. It's a free and supporting counseling service, and it's available for absolutely any healthcare or frontline kind of essential worker. So absolutely anyone who is out working in the front line right now can access this program for free. It's in response to COVID-19, and it's a short-term kind of supportive counseling for us here. It's for anyone in Oxford County who's experiencing stress and anxiety due to working on the front lines during the COVID-19 pandemic. The program is completely free. It's up to 4 one-hour sessions of in-person, telephone, or virtual mental health support. And right now it's offered from Monday to Friday. So if anyone is interested in this or looking for any more information, you're welcome to call the CMHA office. You can either just let reception know that you're looking for to be connected with the Frontline program, or you can call directly to extension 287. And actually, I'm going to just write this in the chat so that if anyone wants to write it down, they can. So the information is there, the office number and the extension, and that's how you would get connected with this program if you or someone you know might be looking for some support related to that program. Now next, CMHA Oxford offers a variety of programs in addition to that. These are programs that were offered prior to COVID-19 and have continued throughout the pandemic and will continue to do that as the pandemic continues. So the first one is our walk-in counseling clinics. Those are also funded with support from the United Way. And through our walk-in clinics, these are something that's free to everyone. They happen in locations all across the county. And it's a partnership with CMHA, the Woodstock Hospital, Oxford County Community Health Center, Welkin, and as I said, the United Way. You get to speak to a professional counselor about what's going on for you that day. Now, right now, this is typically obviously a walk-in clinic is something you would just get to show up at to see. Right now, because of COVID, this is something that's done by pre-booked sessions. So you would be able to call the CMHA office. And again, I'm going to write this number in the chat here. If you're interested in a pre-booked appointment or you want to pass the information along to someone who is, again, it's a free program. You can call this number to book a session, and you're offered either the session to be by phone, or you are offered to come into the office. So for CMHA, if you're booking an appointment through us, we've got options for counseling on Saturdays in Woodstock, on Mondays in Tillsonburg, and on Tuesdays in Ingersoll. We do rely on our community for support for programs like this because it's not funded by the Ministry of Health. And so we're very, very thankful right now to the United Way and to other donations, outside donors that we receive to be able to continue this as a free service. The second one here is just generally attending our Woodstock office. So we're located at 522 Peel Street, and our office is open from 9 a.m. to 4 p.m. We did not close our doors at all during since March, since the pandemic, and at this point we have no intent to. So you can always walk into our office from 9 to 4 throughout the week and ask to speak with a crisis or an outreach worker. It's a great option if you're a friend or a family member who is struggling, or if you're struggling yourself. Often when we're in need of support and we're ready to talk about it, we don't always want to wait until a walk-in clinic time. So this is something that's very realistic. And you can speak with somebody immediately that day. The only difference right now, if you have been to our office before, the only difference that you'll see now is that in our little entryway or vestibule, you enter into that one person at a time. You would pick up the phone, which goes right to our receptionist, and you can see her through the doors there. And she just does a quick COVID screener with her. We all as staff complete a COVID screener before we come into the building. So you would complete a quick COVID screener to make sure it's safe for you to enter. If for any reason you don't pass the screener, then we would make other accommodations to be able to still support you. The third option here, or third resource for support, Eric, is Woodstock office weekdays only, sorry. Yes, so for the walk-in and the crisis team support, it is Monday to Friday only, with the exception we are here on Saturdays, but those are the pre-booked sessions. So we're keeping it that way right now just because of the number of staff that we're allowed to have in the building, and the number of staff that we have here on the weekends, for safety reasons and for COVID reasons. So we are only open to just walk into the building Monday to Friday right now. If you're not able to access support during those times, then give us a call and we would look to book something for you on a Saturday or outside of our office hours. So through Reach Out being another option here, Reach Out is our 24-hour 7-day-a-week crisis line. This is a great option for like any time of day, but especially the evenings or weekends when maybe you don't have anything else that is available to you. A common misconception is that you have to be struggling with a diagnosed mental illness to call this, or you have to be in a complete crisis, whatever you determine that to be. And that is not at all the case. If you are having a rough day, you're looking for some resources, you just need someone to listen, you can call Reach Out. You could, at any time of day or at whatever's going on for you, you can always call that number. If you're not even necessarily looking for support for yourself and you're looking for information on how you can support someone else or anything like that, another great reason to call Reach Out. The next one here is the Oxford Self-Help Peer Support Program. So that is at our office here in Woodstock. We have a drop-in center where we provide various support groups, educational groups, and life skills groups. It's also kind of a safe place for people just to come for a coffee and to be in the community with others. You get the opportunity to talk one-on-one with our peer support staff. Those are all staff who have lived experience of a mental health issue and they know what it's like to struggle. That's still a service that has reopened again. Oxford Self-Help was primarily providing support virtually during the earlier days of COVID through their Facebook page. They continue to provide support through their Facebook page, and also have opened the doors again for the drop-in as well. The numbers are limited. I believe it's 6 people allowed at one time, but you are still welcome to come to that too. Next, we have MHEART. So that's one of our newest partnerships, MHEART. That stands for Mental Health Engagement and Response Team. That started roughly 2 years ago now. And we have our crisis and outreach workers. We've got about 4 of them that ride along with the Woodstock Police and the Oxford OPP from Monday to Friday, 10 a.m. to 8 p.m. Again, there was a short period of time during COVID where they had returned to the office and were meeting police out in the community as needed, but our MHEART workers have returned to the Woodstock Police Station and have a plan in place to return to the Oxford OPP as well. This also is a program that is not funded by the ministry, and so we are very thankful for some support through various outside funders to keep this program going, because it's been extremely successful, and we're very hopeful that we can continue it. So we do work in collaboration with other community partners as well, and not just the police, and we can make connections to places like the community health center, the hospital, addiction services, or Welkin. If someone comes in and we know that there's a program there that might be better suited. Again, some other options for support are like a mental health works or a mental health first aid training or workshop, and we do have those options available for staff and staff teams as well. So that kind of brings us to the conclusion of what I have for everyone today. I don't know if there are any, if anyone has anything that they want to share about what they learned today, or any questions at all about something you've learned or something you were wanting to clarify. If so, now is like a great time. I'm going to just turn my video on here. Now is a great time to either pop onto the chat with a question, or just to pop on as a video as well, whatever works best if you do have a question.
Even if you prefer to unmute yourself.
Thank you, Eric. I'm glad that it was helpful for you.
That's just Eric's, I'm assuming. Yeah.
Yeah. Okay. Well, like I said, what I'm going to do, I'm just going to type in the chat here, not to confuse you with one more phone number, but I'll leave my direct contact information in here as well. If anybody has later today, you're kind of thinking back at the conversation and you have a question, or you have something that you maybe want to talk about that you don't feel comfortable sharing in the group chat, or popping on the screen right now, please don't hesitate to reach out to me, and I'd be happy to kind of answer questions and see how we can support you from there, or feel free to pop into our office here in Woodstock.
So Julie, I want to thank you, not seeing any more questions, for taking the time to inform us today a little bit more about dealing with mental health and stress in the workplace, and stress alone. And everybody practice your deep breathing. So if you have any questions and you missed something from Julie's presentation and you forgot her phone number or didn't get her phone number right, you can reach out and contact me. And thank you very much for coming today. And I think that's not something new. So we'll end it here then. Okay. Thank you for everyone. Okay.
Awesome. Thanks everyone for joining.